I appreciate everyone's patience. I know it's been a long day and we're on the final lap, but we've got two more groups of witnesses to take testimony from. Let's go ahead and call Mrs. Jewel Evans-Lindsay, Managing Director of the Public Service Pension Board, and CFO Ms. Faith Ebanks to the chambers. Ladies, good afternoon, and thank you for appearing before the committee today. For the record, would you each speak into the microphone and state your name and position for the record?
Certainly, Mr. McTaggart. Thanks for having us. Jewel Evans-Lindsay, Managing Director of the Public Service Pensions Board.
There's a button at the right.
Faith Ebanks, Director of Financial Reporting, Public Service Pensions Board.
Thank you both very much. And members of the committee, these witnesses are now ready for your cross-examination.
Mr. Chairman, through you, and this is to the CEO. Can you, I guess, let us know what actions are being done by the PSPB to address the fund deficit identified in the financial reports and the concerns raised by the Auditor General?
In terms of the funding required for the Public Service Pension Fund?
Yeah.
The two reports that the Auditor General speaks to were the 2008 and 2011 reports, and those reports have since been tabled in the Legislative Assembly. But it's my opinion that the results of those reports have been since overtaken by the results of the 2014 actuarial evaluation report, which is due to be presented to Cabinet very, very shortly. Those reports are in the process of being finalized at this point. And I believe that the financing plan proposed there, if acceptable, the government, of course, would address that matter of the underfunding, if that is the area you're concerned about, sir.
My question would be to your CFO. Can you explain to me, Ms. Ebanks, the qualification that arose in 2012, that the overpaid contributions and how that arose at such a large amount?
Well, I don't know if you recall, the last time I was here, we spoke to the exact same thing. And by the way, that qualification fell away the next year. It was a combination of things. It was accounting that was, I don't want to say poor accounting, because that would cast some aspirations on my predecessors, but it was things that accumulated in the general ledger, that a lot of things was accrued that wasn't backed out. There was a number of situations that gave rise to what we perceive to be an overpayment. Reconciliation has been ongoing and for the most part completed, but a big part of that overpayment, 1.45 million to be exact, was past service liability that really should not have been accrued for and had no bearing on individual account balances.
Okay, thank you. I understand.
Chairman, through you, and again to the CEO, in terms of the governance report on page 56, and in particular number 74 on bullet point 2, and I guess that initially, and then just by way of question, these matters that were raised by the Auditor General, how have they been taken on board, and what's being done since this report to address these matters? But starting with the policies and procedures.
Okay. And we're speaking to page 56, the governance report, paragraph 7 to 4. And Mr. Conley, you're asking for a response to each of the 4 bullet points? Okay. Policies and procedures, the bullet point dealing with policies and procedures, that has been resolved with effect from the 30th of June 2000. This one, policy and procedure.
With effect from June 2013.
With effect from June 2013. So we took on that recommendation that has been addressed. Similarly, the next bullet point, year-end financial statement closure process, that has also changed and been resolved with effect from the same period, 30th of June 2013. And And the final bullet point, compliance with public service pensions law. Unfortunately, I have to say that we still struggle in that area, and we have long, for years now, advocated for that legislation to be amended to reflect best practice in a more realistic time frame, because 30 days is virtually impossible.
And with regard to that, in terms of your representations to I guess the relevant minister and ministry and the government as a whole, why do you think that's not being kind of made a priority and pushed forward? I mean, has there been any feedback as to why not, or just that we'll get to it? I mean, so.
Yeah, it would be speculative of me to say why they push it back, but it has been by successive governments.
But, Mr. Chairman, through you as well, I mean, and again, I don't know what this committee can do, but that to me is something that, you know, notwithstanding it being good best practice, it's something that I individually would recommend, but I don't know what this committee could do to assist the CEO and CFO in their quest for best practice. I mean,
I can say this much, Mr. Conley, if I could, through the chair, that another bill has been drafted and now sits with the deputy governor, and I understand it's under consideration.
We're free to make whatever recommendations we want. I'm not, whether they'll get acted on is another thing, but we can make the recommendations. Yeah.
Yeah. Thank you.
Again, I do note that from the Auditor General's report here, that you you just prepare one set of consolidated financial statements for all of the pension funds that you manage. Am I correct?
That has since been corrected.
Yeah.
That has been resolved as well.
Okay. Okay. Well, that's good news. Thank you.
Yes. Yeah, as of June 30th, 2014.
Okay. Just glad to know it's been addressed. That's great.
Yes.
And if I could, I mean, I know that the 2014 actuarial report, it may be a bit premature to discuss it because we don't have it here. But the previous actuarial report showed a severe underfunding. And if I'm correct, I remember, I think certainly in the 2013 and 2013-14, some sums were included in there to fund the past service liability cost.
Yes.
Has that made any substantial difference to towards reducing that unfunded liability, or does that continue to grow?
We are grateful for that contribution, and it does make a difference. If we could have the government continue in that vein and continue to improve upon those contributions, that would be great. But that has made a difference.
Okay.
Of course, along with our good investment returns, has sustained the funds in a meaningful way, yes. And I believe that the results of the 2014 actual evaluation reports, even though we don't have them in front of us and they haven't been tabled, that I believe that that the funding recommendations probably the government will find to be achievable.
Okay, that's good news. Any other questions for these ladies? It's late, but I'll go ahead and excuse you. Thank you very much for appearing before the committee this evening and giving your testimony, and we'll excuse you at this time.
Thank you for having us.
Thank you, too.
Since we had unqualified financial statements 2014, I guess we won't be back. Hopefully.
Let's hope there are no governance issues.
If Alistair let us off the hook.
And 13.
And 13.
Never that straightforward. But I would point out that actually that the pensions board, where we used to have some delays in terms of annual reporting and account, that we signed off at the 31st of October 2014 for their pensions this year. And they were one of the two that got actually tabled in the Legislative Assembly in terms of timescales as well. So that was a step forward as well.
Congratulations to you.
Thank you.
Thank you. Thank you so much.
All right, we're getting around the final lap very quickly here, Jen. Well, let's go ahead and call our final witnesses into the chamber. Mr. Lonnie Tibbetts, I believe, from Cineco, and Mr. Frank Gallipi, the CFO. Good afternoon, gentlemen. Thank you for taking time to appear before the committee this afternoon. For the record, would you please speak into the microphone and state your name and your position?
Good afternoon. Lonnie Tibbetts, CEO of Cineco.
Good afternoon. Frank Gallipi, CFO of Cineco.
Thank you very much for your. Thank you. Members of the committee, these gentlemen are open for your questioning.
Mr. Chairman, through you to the CEO. The Auditor General has raised some matters relating to the financial accounting and reporting of your entity as it respects the eligibility file data. Do you have an action plan to address the matters he raised, and would you be so kind as to share them with us today if you do?
Through you, Mr. Chair. Thank you, Mr. Connolly. Yes, sir. We have, from the report that was presented on Cineco, there were two, I think, concerns presented or expressed by the Auditor General's office. The first being that we generated a financial loss for the period in question, and the second being the control over the eligibility file of the single largest subscriber group within the Cineco family of covered persons. At this time, I'd like to address the first issue regarding the profitability as a SAGC and our fiduciary responsibility to sustain in Cineco's equity and value. During the period in question, the premiums that were prepared in regards to were determined as we do each year from an actuarial perspective, and were presented to the current government at the time, at which time they responded in the form that they were unable to remit payment to us in accordance with our actuarially determined premium, and basically what they could afford they would remit to us, which they did during that period and I think a number of years since. And as a result, we subsequently sustained a loss, which was pretty much predictable. The other component regarding Cineco, per the report, relates to the current National Health Insurance System, which is an Oracle database currently deployed by the Computer Services Department, to which the primary eligibility file for the civil servants and pensioners, persons that are covered by Cineco, is derived from. The challenge with the existing database, firstly, is that it is maintained by an extract from the current government HR IRIS system, which is and it's purportedly automatically updated on the eligibility file of the NHIS. The challenges with that is a number of departments do not maintain accurate records, do not update member profiles timely, do not terminate individuals in and out of the civil service timely, and as a result, our eligibility in its current state or under that current regime runs an elevated level or an elevated probability of being flawed. What causes a material concern is the fact that we may have persons enrolled on the system to which we have recognized as being eligible and fully covered, who incur claims and cost when in actual fact they should have been terminated. We've had some material cases that were a result of this, and only when subsequent reviews of invoices retrospectively did persons from the HR departments of some of those organizations or some of the departments would make representations that that individual or those two persons are no longer with us, etc., to which we would then have to retro terminate them and accordingly recognize any losses or claims or absorb those, so to speak, and as well as refund any premiums that were paid in error by the department for their own error for maintaining the eligibility file accurately. To date, the matters that we've put in place to mitigate these risks The first of which, it's quite difficult. Seneco is still owned by its shareholder, the Cayman Islands government, and the Cayman Islands government to this date can still basically remit to us as the owner essentially of the company what they deem appropriate to pay the premiums. We have no recourse in that regards, and it's a challenge in itself. But for most part, I think we've made do with what we were given in most years. This became a material issue during this period because we found ourselves exposed to a large debt that was uncollectible from our shareholder at the time, and that subsequently caused us a number of issues. We have put in place a proposal for the upcoming year to put an actual administrative services agreement in place that mandates a better control in regards to the administration of the indigents and the cost incurred, and mitigate our risk of exposure with regards to an uncollectible claims cost, which we have paid and sought reimbursement from the ministry and retrospectively. The second component with regards to the eligibility and the exposure for the coverage of uninsured persons and claims due to eligibility issues are, we've now updated the SPD, and in the event such an event should occur again, we now have the capacity in that summary plan document, which is the contractual agreement between ourselves and POCS. We now have the right to solicit directly from that department the cost of any claims incurred for persons that were no longer eligible, but they did not update the eligibility file timely. And finally, our long-term plan is to essentially take over the NHIS system with either one of our own or mirror it onto an existing system, and then essentially take back over, work with computer services to clean the data that's in there and essentially reset it. There are a number of flaws in the extract. As you can appreciate, one computer system talking to another computer system, there are times when the data isn't exchanged properly and one system does one thing to the other. There's a number of concerns regarding how it's written, the program is written as well. For example, hierarchy is written for Iris. So for today, if you were to present to one of our client service managers or your HR manager, our client service manager could log into NHIS, the database which we extract data from, update your PO box or your address, etc. And then at the next week, when the data uploads again from Iris, it will automatically override the NHIS. So it's an exercise in futility, so to speak. What we've tried to do is put a new system in place, which we're partially there, where when POCS or an HR, anyone in the HR department of any government department updates that data, it'll synchronize across the board of all systems. But to do that, we essentially will have to take NHIS offline and reset its parameters. But we are with our new TPA, we're now setting onto a new platform with them that will permit a mirror of NHIS. Then we'll function with them as primary and then retrospectively update NHIS once we've cleared it and reset its parameters. But we have to be cognizant that Seneco has been in operation for over 10 years now, and there's quite a large amount of data that's in there and quite a large amount of errors as well. So those are some of the challenges we have with that project, but it is our goal to mitigate that risk across the way.
Thank you, CEO. There's been a lot of discussion about the AIS contract. Can you describe what's happened to that contract and whether or not the cancellation or termination of that contract had an impact on the operations of Seneco?
Through you, Mr. Chair. Thank you, Mr. Connolly. The AIS system primarily was deployed at the HSA to adjudicate dental, medical, pharmacy, and vision claims that were incurred or produced by the CIHSA. They ceased operations on December 5th, 2004, 2014, at which time we resumed the adjudication of all CIHSA claims via our new TPA, ABS, out of Detroit, Michigan. The Cerner system at the CIHSA produces an industry standard 837 formatted extract, which is adaptable, some minor changes to an input protocol by the claim system of ABS, and we've now almost finalized the nuances with that, and their shutdown won't have any material impact on the processing going forward. There are some issues regarding claims that weren't processed completely or properly by AIS during their period at the HSA, and we're working with the CIHSA now to reconcile those differences, and we will then adjudicate them through ABS, who's our new TPA at this time.
With regard to these legacy sort of issues from AIS to your new TPA, I mean, how far along are you in that process?
The ABS came online in January 2014. All plans have been programmed. We have since synchronized the entire batch of Cineco claims onto multiple platforms of claims data, one being an active for analytics, the other being a historical. So we still have access to our claims, and we now are putting in a VPN port at Cineco to have immediate access to those. The new platform gives Cineco the capacity to have full dashboard management, real time of both our claims history and our current claims, as well as our flows, and basically a status of all of our claims that are actively involved. That's completely new to Cineco. We never had that. We were kind of query and wait, but we're now real time access to see where things is. The AIS system, prior to their shutting down, was busy or was working with ABS to synchronize their claims and iron out their nuances. For the most part, they completed that. We don't think there's a large exposure or a large part of their claims that ABS, the new TPA, has not received from AIS. However, if there is, it would not be in AIS's benefit to retain those or keep those, because we won't pay them for them until ABS has possession. With regards to the actual cost or any effect to us, there has been we have voiced some concern regarding an implementation fee, which has been paid for AIS, which, as prudent accounting, would allow us to amortize the cost of that over the period of the purported contract, which was 5 years. Since the contract, or since the AIS ceased operations in December, we are possibly or probably examining recouping some of those costs.
Other than the AIS, are there any other contracts that have been renewed or not renewed in the that have not been renewed or terminated by Cineco that would affect any of its operations?
Well, we did sever ties with our original, with our former TPA, Simplify. Simplify was the original TPA for Cineco was a part of a company that was the original, but during its tenure with Cineco, it changed a number of owners. In the last year of our contractual agreement, it went through another change. The new owner presented to us an offer to pretty much extend services beyond the contracted period, and at which time we, under proper CTC rules and governance, had to publish an RFP, and it was again part of prudent management to see what other services were out there and if we were really achieving value for money. We had no obligations, nor did we find it it wouldn't be prudent accounting or prudent acquisition or protocol to keep ourselves with one entity for a certain period of time without publishing another RFP, because their original RFP contract had expired. And on my arrival at Cineco in 2010, we were on a year-by-year basis. At the conclusion of that period, we did contract with them for a 2-year period with an option to a third. But that time, the option, it was predicated on the capability of the new AIS system, which was acquired before I got to Cineco. At that time, the new contract with Simplify, at the time was CBCA, was renewed under those auspices and recognizing the environment of Cineco and its processing had changed. At the conclusion of the period in which we could negotiate a change in the contract, we expressed that and also exercised our right to exit the contract. With what they now contend as a breach of contract and have filed a litigation. We are currently involved in litigation with them as the debate of a contractual period, which is not on the contract, which has never been priced or any type of determination regarding what is owed or what is not owed to them beyond the period of the contract or what rate to be remitted. It's quite interesting that they would file suit. But we have since been embroiled in that lawsuit since, I think it was July 2013, during which time we did not have a TPA and Cineco presumed internal local-based operations to process claims from a manual perspective. To the most part, we accomplished that. Unfortunately, we've had some issues where some weren't located, weren't found, and we subsequently were served a number of lawsuits for Florida-based providers, which for the most part, truth be known, were not necessary at all. We just weren't presented the claims.
Thank you, CEO. And in terms of the financial impact on Cineco, I mean, have you done a kind of worst case scenario as to what these claims could be if you lose or, if you reach settlement and other things like that?
It's quite difficult to answer, to be honest. As I presented, and I certainly will present to the committee any contract you desire, the contract had a period in which once AIS was adjudicating the CIHSA claims to 100%, being dental, medical, pharmaceutical, and vision, the contract between ourselves and Simplify would have a material change whereby we would no longer remit to them a per member per month adjudication fee or claims management fee to the tune of about 150,000 US a month. It would fall to the minimum of 30,000 per month or a per claim basis of what we adjudicated outside of the CIHSA to them on a tiered basis. The challenge we had, as we've expressed and clearly evidenced in the lawsuit to which we're defending, was there was no contractual agreement past June 30th, 2013. Even if there is clause or reason to say that there was a breach of contract, the entire environment had changed to this $30,000 minimum. So to say they have a claim worth $150,000 a month versus $30,000 a month is the parameter to which we can only peg our maximum exposure. However, the date and time was there. So the period after that is what becomes a debate. There isn't any fee schedule past 6/30/2013 in our contract, nor was the period before the contract ended at 6:30. It had a clause in it requiring a notice period, which was served more than ample time, and to which they debate the notice itself wasn't technically correct. However, the state to which they reside as an administrator and to which they are licensed recognizes the EULA laws of the United Nations, whereby email is sufficient notice in all aspects.
Good luck.
Thank you, sir.
But in terms of your controls in place and looking at this specifically from how do you ensure that your cynical is paying for only for the services that its patients receive, and can you describe those systems of control and how that's carried out? And then the second part of that is what is the risk, if any, of cynical paying too much for services received or not received, and how do you mitigate that risk?
Through you, Mr. Chair. Thank you, Mr. Conley. Cineco has essentially 5 sets of claims that we manage each day. We have member reimbursements, we have the CIHSA claims, we have local provider claims, we have US-based provider claims, and then we have all other provider claims, including Jamaica, Honduras, India, Philippines. We get claims from those. In addition, we also manage our home health care for our members, which is a covered benefit under the different plans. So it is quite a plethora of claims and of sources. From a cost perspective and revenue to expenses, about 50% of Cineco's covered or insured revenue is utilized in US-based destination and facilities. What we have done to mitigate a number of things over the last couple of years was, the first, we had essentially 2 governing agencies with regards to the management and monitoring of US-based care for Cineco. First of which was CMN. CMN provided us with 3 unique services. The first being access to a US facility for discounted rates and parameter control of contractual agreements. The second being 24 hours air ambulance coordination, which goes very much hand in hand with access. One of the most difficult things is getting into a trauma facility or into a US facility without a contract, especially for trauma-based or urgent care. So it was good to keep those 2 together, the network and the air ambulance. The third being medical case management, also known as utilization management. The concern we had at that time was under that previous arrangement, there was, by no means are we accusing them of anything, but there was a moral hazard. In other words, the longer you stayed in a US facility under that contractual agreement to CMN, it benefited them because they got a percentage of the discount on every claim per their agreement. So one of the first changes we made at Cineco on my arrival was the board, we examined the parameter of our risk and our exposure. And the RFP that we published was to essentially find an alternative case manager. The alternative case manager, utilization manager, that we chose was MMSI Health Solutions, now named Mayo Health Solutions, part of the Mayo Clinic organization. What happens when when you receive an overseas or US-based referral, the referral is materialized by your primary care physician locally. It is then authorized by the chief medical officer. It is then submitted to MMSI to start the coordination. They acknowledge receipt of the referral, the medical notes, and any type of information they require to begin the coordination of the case. They then contact a provider and coordinate their travel arrangements, times that they're available, as simultaneously they contact one of the number of our facilities in the network and look for the particular specialist, or if it's a follow-up or a returning to whom they seek. Once that is collaborated and coordinated from there, the members then, as you can appreciate they travel to the U.S. They then attain the care or the interventional care, surgery, whatever it's needed, it's taken care of and covered. At that time, MMSI issues pretty much a letter of guarantee to that facility for the services within the parameter of the authorized care. The authorized care parameters that they utilize, the MMSI or the Mayo Clinic has their own parameter of case and utilization management, and we also in-house utilize Milliman guidelines, which is possibly the best standard in the healthcare industry at the moment, to monitor based on the diagnosis, based on the prognosis, based on the intervention or the treatment, the base parameter for this. Once the person obtains the service, the claim is then subsequently generated. It is then, and in Florida, just to let you know, hospitals, providers, other facilities can submit a claim as late as 360 days from the date of service. That in itself is a challenge to manage and monitor those claims from what you would consider an open ticket. So at that time, the LOG is issued to the provider, the claim is then produced, they remit the payments and the claims in a court, they remit the claim to MMSI initially, who coordinated the care, managed and monitored the utilization. The claim then is presented to them. They examine that based on the parameter of care and the services that they authorize. If there is an issue, they will reject the claim and pass the rejected claim. What's called in the electronic format, most of the claims come through, or if they're hand paper type, they're typed into the system. At which time, MMSI will present what's called hold codes. On each line item, they will identify what's authorized, what's rejected, what's not appropriate for this, or wasn't inaccurate, wasn't sufficient, or incorrect, etc. That hold code is then attached to that claim separately, because the claim in itself is a representation from the facility to Cineco. MMSI nor anyone else is allowed to touch that claim because it could be a component of fraud. So it's tagged onto it, kind of like a comment on a box, so to speak, presented to the actual TPA, which at that time was Simplify. They would adjudicate the claim based on the whole codes, immediately produce an EOB of a rejection and resubmit the rejected claim with the particular whole codes or whatever it is back to the provider. If the claim was fully covered or it was accurate for what they authorized, it would come with just a generic authorization code saying process accordingly, which they then would adjudicate against industry standards, etc. And then against, obviously, our plan, any plan benefits, exhaustion, exception, the usual rules. And then produce a pre-fund registry for which Frank would authorize as the CFO in accordance with the referral that was originally materialized. When Simplify shut down and walked away from the table, we essentially had still quite a bit of control over our claims. So when we finally found them, we started processing them through a yea or nay, essentially from MMSI. Most times the claims report that we found, because it was being managed and orchestrated through a special data company, we were able to collect those claims in a very unique 837 format that presented us with a spreadsheet probably about the size of that wall across the way. But we were very good, and Frank did an excellent job of working through them, and we created some special formulas through the spreadsheets and amalgamated them in a very user-friendly format to adjudicate, which we did in-house against plan, benefits that we knew at the time of the shutdown, and we were able to maintain our functioning and processing and paying our claims. But what I want to assure the committee and the members of the meeting today is that no claim that is presented in the United States for US-based care that which we authorize or refer is not monitored through multiple phases of the process. What causes the biggest breakdown is the providers to whom have provided the service and have produced the claim do not submit the claim through the proper channel. That is probably the biggest detriment to maintaining a clean flow, logistics, and mitigating any type of issue between ourselves and the providers.
Thank you for that, CEO. In terms of I guess risk, would, or is there any risk that people with Cynical cards go to the US and get rejected based on the ongoing litigation and the headlines stating, bills not being paid? Is that something that you see as a risk, perceived or actual?
Through you, Mr. Chair, thank you. There's always a risk that a provider may represent that we have an unpaid claim with them and they would like that settled before they see our members. I have never found or heard of anyone being rejected because of them being a Seneco member. I would also like the committee to know that on my arrival at Seneco, I inherited two very large unpaid claims that were unpaid from the Ministry of Health regarding advanced members, to which Seneco, I think, absorbed the cost and mitigated that litigation that was completely unfunded. In addition, the primary cause of the litigation to date, almost all cases could have been avoided, but unfortunately, a number of the U.S. facilities simply manage their litigation or threat of litigation from a perspective that if there's an accounts receivable ledger presenting a period of unpaid claims for X amount of weeks, months, or days, they immediately produce a report and solicit an attorney to examine and resolve these claims. This puts a big challenge because we could have an email on Monday saying we have these claims that we need you guys to pay or find out where they are, and on Tuesday we could have a claim from an international representative of the same facility saying, Lonnie, business is down, when are you guys getting us new business? We want to work with you and get more business to us. So there seems to be a lot of disconnect between the two organizations and what's happening. Case in point, the latest case with Tenant, I'm traveling to the US tomorrow to mediate that matter. Our records in-house indicate that they owe us $17,000 because of duplicated payments during the simplified period. So the international representative of Tenant, when we received the lawsuit and we contacted him and said, what exactly is this, was equally as surprised as us that it had went to that. So we do recognize you're working with large organizations where there's disconnects. What we managed to ascertain was that they received the funding, and because they did not know how to allocate the check across the claims that were outstanding, they essentially deposited the check and never took the receivables off their books. So it should be a very interesting mediation. It's actually scheduled for Friday, but we're meeting with the attorneys tomorrow to go over all that we've ascertained to date. There's always a risk regarding someone refusing care for whatever reason. It's not always about monies that are owed. We've had physicians that have, said, no, we're concerned about your current network provider and the discounts that they take on our contract. But providers contract with aggregate network providers for guaranteed business. It's a win-win for them. And unfortunately, during the period of time when Simplify shut down, and if you examine or a TPA to a insurance company is equally, it's the heart of that entity. When you find yourself exposed to that a void hole at that point, you find risk that these are the things that fall out. What we did find, ironically, is that we pretty much paid everything that we found, that we got, or that was sent to us. When any issue arose, it's what wasn't sent to us. The transition over to the new TPA wasn't, and it's not as simple as turning a switch on and off. The problem we had was the period of claims before Simplify shut down and the period of claims in which we processed during Simplify's absence. We had to merge that data together to make essential and informed decision on what claims we had now subsequently received. That took a little longer than we anticipated. We're not sure whether the new TPA didn't quite understand the process or the challenge that we were faced. But what we can safely say is whatever claim Seneco received, we paid. And case in point with the tenant case to date, until we find any other evidence to the contrary, all that we've located through our system and during that down period, we paid. The case that they're raising right now is the delay in payment may have mitigated any discount that we were eligible for. But we will show them that the accounts receivable and accounts payable between ourselves and themselves, they were always in an owing to us because we had overpaid them or duplicated payments. So, we're hoping for a positive outcome of that and the mediation, but the risk of our members being refused overseas care, I don't think is a viable one. And I would like to add, in the medical profession, there's the hypocritical oath that says you must treat and care. I would question any physician that refuses my member, irrespective of what the relationship is regarding that, and that would not be a physician that I would, in a way, continue to solicit for services or continue to expose our members to.
Thank you again. Just looking at page 18 and 19 of the report, and again, I know this is year ending June 30th, 2012, but I'll ask for a kind of update post that to now. And, we're talking about the sharp rise in medical claims paid under paragraph 53, which said it was over 20%, while revenues hadn't kept pace. And then it talked about government directive, right? And the fact that government reduced or discounted the civil service premium, etc. Can you tell me if that situation or similar situation still exists, and how much of effect is this on your ability to operate as a going concern?
Through you, Mr. Chair. Thank you, Mr. Conley. Yes, we continue to find ourselves pretty much on a negotiating table with every administration regarding our premium. We actuarially determine them each year. We have an actuary that has been we're very pleased with their work. They have consistently identified a very safe range for us to be in each time. We are cognizant that our shareholder, as everyone does from their own perspective, has cash flow issues sometimes. Seneco is a cash business. We collect a claim, we pay a claim. It's pretty much in and out. But we do have to recognize that SEMA's base minimum of $3 million is a genuine requirement. Failing that threshold, we are no longer compliant with a Class A and essentially no longer permitted to write business. In addition, if we incur uncollectible debts from the from our shareholder, the Cayman Islands government, and which we experienced during this period and was unable to obtain an actual guarantee or a commitment to service the liability in which we incurred via the administration of the indigent plan, we found ourselves in a dilemma where we would have had to write off approximately $8 million or a little over $8 million in bad debts in regards to the indigent claims, which would have put Seneco in a non-compliant position and possibly a going concern with regards to our audit. The situation, unfortunately, continues to present a challenge to us because under the mechanism with the administration of the indigent care and the plan, Seneco essentially will pay for it and seek reimbursement from the Ministry of Health for the cost. And sometimes it's a challenge to get paid timely for that. And we consider most commonly is the funding for the indigents continues to be significantly under budgeted. So that NGS 55 continues to be which is the component of overseas care for the seafarers and veterans as well as the indigents outside of the HSA and overseas. That particular fund continues to, I think, from its existence, continue to be completely funded via supplementary budgets. I don't think any single budget has predicted it, but it in itself is an unpredictable number. We have worked with the ministry to try and put together a plan whereby the indigent fund consists of two distinct sets of individuals, one being permanently indigent and those being somewhat temporarily indigent or medically indigent. And the permanent indigents, that particular group, consume about 48% of the annual budgeted amount, and the temporary consume, I'm sorry, it's 52 for the permanent and 48 for the medically indigent. We usually get large catastrophic cases of uninsured persons who usually are financially challenged. And it can easily consume quite a large number of funds on one single event. How best to manage that fund, unfortunately, is I think the Ministry of Health has tried. We're all working with it. We're thinking different capitated models, other things to look at, and we still have not found any single fix for it. And unfortunately, the group of individuals seeking government assistance for medical care continues to grow.
And just my final question is in terms of organizational capacity to address concerns of getting accounts in and things like that. Although you're moving along and getting there. I mean, what's Cineco's organizational capacity at this time, and in order to kind of max or be optimal at its optimal level?
Well, we're trying to extend the 24-hour day and the 7-day week now. But through you, Mr. Chair, thank you, Mr. Conley. We currently employ a total of 21 permanent employees at this time. This is part of our strategy to begin our in-house medical case management. That has been the single largest growth in any one avenue of our business. We've also restructured the organization with an emphasis of what we considered redundant coverage or duplication of coverage. We've had situations where there's one individual that only does this, and we found that was not productive. So we've changed our client approach to a client service management approach, where you have a designated client service manager to deal with any issue that you have. We found that has improved our service. The new platform with the new TPA, we know, will also give us a lot more much better information and more very quickly, timely, pretty much instantaneously to present to the number of government departments to work with our shareholder on how we can stratify a different approach and mitigate risk, for example. These are the things that we know will have long-term effects. We've deployed a wellness program for the civil servants, and we're slowly ramping up our efforts with regards to that. I can honestly say I don't know of any government agency or department that wouldn't seek or wouldn't desire additional bodies to help carry the weight. But Cineco continues to be very efficient. We have boasted operational costs per revenue of 6, 7, 8%, I think, at best sometimes, from an expense perspective. We continue to manage approximately 15,000 lives. We coordinate 300 plus referrals a month locally, 100 between the 3 islands, over 110 a month overseas on average, Florida as well as Jamaica. And we do all of that with 21 exceptional and dynamic and committed employees. With regards to our financials, the biggest delay or cause of any delay that we've had was with regards to our shareholder and the dilemma that we face, whereby the large outstanding indigent debt that was owed to us, or the refund of the indigent debt, was prohibited from being guaranteed or assured or any way gave the auditors satisfaction or felt any assurance that it would have been honored. We were very pleased with Minister Archer when he assumed the post, and Seneco went from under the Minister of Health to the Minister of Finance, that he went above assuring us of that issue. He paid us a check. So that made it a lot easier for the auditors. It changed the entire dynamic of that risk or what we consider the financial quagmire that we were in at the time. And we subsequently then, we were about to produce our financial statements, but it was presenting us in a going concern and non-compliant to Seneco. I'm sorry, to SEMA. Having said that, we had to recomplete and adjust our financials accordingly. And we're finally back on the track, so to speak, during which time we went through no TPA, change of an auditor, and embroiled in multiple lawsuits to date. It's one of those things. This is it's the health business it's tough. It's not as predictable as you would like to believe, but we are still. I consider us probably one of the best and very efficient department with what we produce, with the quantity of staff that we produce it, and we're actually going to get better. Thank you.
Any other questions from members? Okay. No further questions then, Mr. Tibbetts. Thank you very much for your testimony before the committee this afternoon. You're excused at this time.
Thank you, sir.
Members of the committee, it's been a very long day, and I know we are feeling exhausted. I want to thank everyone for your presence and for your patience as we have struggled through the agenda today. It's been long. I think we've completed that and completed our work, and now what remains is for us to draft and to write the report and have it approved and tabled in the Assembly. So there are no other business to come before the committee. I've declared the meeting duly closed, and thank you all again for your attendance today and for your patience. Thanks a lot.